Hello, and welcome to another edition of the Eye Associates Sight for Life and so much more. I'm Jill Graw, Patient Care Coordinator at the Eye Associates. Today, we will be talking about diabetes and how it can affect your eyes. I have with me two of the most skilled and well-respected eye doctors in the area, Dr. Joshua Malley and Dr. David Rubin. Welcome, doctors.
Thank you.
Dr. Rubin, I know that you're a board-certified optometric physician. Can you tell our audience a little bit more about yourself and your experience?
Sure, Jill. I got my training at Rutgers University up in the Northeast. I got my professional training at the Pennsylvania College of Optometry in Philadelphia. Shortly after that, I moved to the Venice area where I've been providing eye care ever since. And then late in 2015, I joined the Eye Associates to continue the tradition of quality eye care that they provide in the communities that they serve.
Well, now, Dr. Rubin, I understand that you've been involved in, and even the president of the Florida Optometry Eye Health Fund that actually assists patients or residents that need help with eye care.
Yes, Jill. I've been privileged to be on the board of the Florida Optometry Eye Health Fund, and I served as president. And this is a nonprofit organization that serves the state of Florida. We fund other nonprofits throughout the state, and those other nonprofits provide care to those who are in need of assistance.
Well, now, Dr. Malley, I know that you're actually a fellowship-trained retina specialist. Can you tell our audience a little bit about your background?
Sure. Thank you, Jill. It's a pleasure to be here. I did my undergraduate and medical school training at West Virginia University. I then went on to Albany, New York to complete my ophthalmology residency, where I served as chief resident. I stayed on board in Albany Medical Center and completed my medical and surgical vitreoretinal fellowship at Albany Medical Center, where I also served as an associate professor of ophthalmology. And then I moved here to Sarasota to be here at the Eye Associates.
Well, we're glad you're here, but I'm going to brag on you just a little bit more. I know that you've actually been published in JAMA, Ophthalmology Times, Retina Today, and you've even had one of your surgical videos actually selected by the American Society of Retinal Specialists. That is very impressive.
Yes, Jill, I strive to master my craft and be on the forefront of the retinal community and serve my patients here in this area. So I'm really excited and really happy to provide services here.
Well, now, Dr. Rubin, tell us, what is diabetes?
Well, diabetes is a systemic condition. It's a disease that affects multiple organ systems. It's thought of as a disease where the body doesn't utilize glucose, which is a sugar that is the body's fuel. And when the body can't utilize those sugars effectively, they will build up in the bloodstream and even in the urine, and they'll cause problems in multiple organ systems, the eyes just being one.
Well, now, Dr. Rubin, is it true that diabetes is on the increase in the United States?
Well, it's felt to be rising in epidemic proportions throughout the United States. There are in excess of 25 million Americans that have diabetes right now, and it is felt that a third of the diabetics that are out there don't even know they have the disease.
Wow. Dr. Malley, are there different types of diabetes?
Yes, Joe. We actually classify diabetes into typically two types. There's type 1 and type 2. In type 1 diabetic patients, these are typically younger patients. And the main issue with these patients are that they don't produce enough insulin, which insulin is a very important chemical mediator in our body that helps regulate our blood sugar levels. So if you can imagine, they can't create insulin and they can't regulate their blood sugar levels. In type 2 diabetics are typically older, and they have a combination of problems where they have two things. First of all, they sometimes don't make enough insulin, and also that insulin they do create actually is not really effective, and so they're unable again to regulate their blood sugars adequately, and that's what we see all the complications with diabetes from this condition.
Well, Dr. Rubin, what causes diabetes?
We don't know all of the causes, but we think in terms of risk factors to developing diabetes. And risk factors include a sedentary lifestyle, being overweight, and certainly having a family history of diabetes is a significant risk factor to developing this disease.
Can you actually be born with diabetes?
You can. Anybody can be diabetic at any age. We have the juvenile forms that Dr. Malley mentioned. We have the type 2s that are generally older. And in fact, in public life, there are people that have diabetes that you would never have imagined, such as Andre Bocelli, for example, the famous opera singer. He's a diabetic, and the famous astronaut John Glenn, both diabetic. Anybody can be diabetic.
Well, Dr. Malley, who is actually at a higher risk of developing diabetes?
I tell all my patients about the big three. The big three really risk factors for progression of diabetes. Number one is blood sugar. We know that higher blood sugars cause progression of diabetes. The second thing is having high blood pressure. So typically it's really important to control blood pressure in diabetics. And thirdly is high cholesterol. So it's really important that patients work with their primary care doctors to help manage the big three essentially.
So, Dr. Rubin, how does someone know if they have diabetes? Are there actually tests that can be done to help diagnose this?
Absolutely, Jill. Primarily, most diabetics will be discovered in the course of the examination that their primary care physicians will do. They'll do blood tests, urine analysis, and they'll come up with the diagnosis of diabetes. But what a lot of people don't realize is that sometimes the first indication that a person is diabetic will occur during the course of a comprehensive eye examination. And then if we discover that a person's diabetic, then we'll communicate with the primary care physician so that that disease can be properly managed.
Well, Dr. Malley, what is a hemoglobin A1C?
Just like Dr. Rubin was mentioning, I mean, it's so important to have a complete health examination by your primary care doctor. That's the most important thing. And actually, one of the tests that we do is a simple blood test that actually can help give us an idea of how well the blood sugars have been running for about a 3-month period. And essentially, that's what the hemoglobin A1C number is. It kind of gives us a sense of, you know, how has the blood sugar been controlled over a 3-month period of time. So actually I have a patient that always talks about her hemoglobin A1C, and she always mentions the fact that it's such a motivational factor for her in order to help see how well she's managing her blood sugars, and she's able to kind of strive to reach that number that what her goal number is. And I think that's really important for patients to have that motivation of, you know, I really want to control my blood sugars. I really want to conquer this disease. So that's one of the key blood tests that we use to help monitor somebody's diabetes.
Well, tell us, what are some of the symptoms of diabetes, some of the most common symptoms that you could notice?
Well, Jill, it can be very vague at first. So you could have no symptoms at all. And you know, sometimes we see very, very vague symptoms, such as being thirsty all the time, being tired, fatigued, in our field having blurry vision. That's a very common symptom, numbness and tingling in their arms and legs. You know, so you can imagine diabetes affects the entire body. So it can really affect any part of the body, and people can have very kind of subtle symptoms at first.
So then, Dr. Rubin, how does diabetes actually affect the eyes?
Well, diabetes will cause a spectrum of disorders in the eye that we would lump together as diabetic eye disease. And that includes everything from retina problems to various forms of glaucoma and cataract. And it basically, much of it all starts in the retina, which is why we're going to talk a lot about retina tonight.
So is it one of the leading causes of blindness?
In fact, it's the leading cause of blindness in people that are mid-20s to their mid-70s, and unfortunately, it is a preventable form of irreversible loss of vision, though.
It's so right. I mean, it's such a common thing, and such a common thing that we see is you know, blurry vision and visual loss from diabetes. You know, about 4 million Americans are now affected by diabetic eye disease, and that number is actually going to jump to about over 6 million people in the United States alone in the year 2020 with changes from diabetic eye disease. So it's a really common problem in our community, and probably most of our listeners know somebody with diabetes or may have diabetes themselves. So it's really, really important to get checked out.
Well, Dr. Rubin, can the blood sugar level cause the vision then to fluctuate?
Absolutely, and sometimes that is the presenting symptom of diabetes is blurry vision, and that's where we come in. And sometimes we'll run into this where the common complaint would be blurry vision, which is an extremely common complaint. Somebody will get their new glasses, and then their vision is still fluctuating because they don't know they're diabetic, they don't have the disease under control, and it may take a few weeks or a few months, but all of a sudden they're blurry again. They'll present to the office, we'll recheck their prescription, we'll find something significantly different than we did a short period ago, and in my book, that's diabetes until proven otherwise. And that can be in the absence of some of the other signs that we'll find during an eye exam in the retina.
Now, Dr. Malley, is there an increased risk of cataracts whenever you have diabetes?
It's interesting, Jill. Actually, diabetics are prone to a certain special type of cataract, which is called a PSC cataract, or posterior subcapsular cataract. And actually, we see this early on in an earlier age, so typically not even an older patient doesn't have to be necessarily. It can actually happen much sooner, and it can be very, very, very detrimental to vision. So you can get a lot of glare and a lot of blurry vision from this type of cataract. So it's a really important cataract to address, and we actually, here at the eye associates, we have fantastic cataract surgeons that are able to deal with these type of cataracts and have the expertise to handle these conditions. So really, we have a really great practice here.
And Dr. Rubin, is it true that patients are actually twice as likely to develop a type of glaucoma?
Yes, there's a particularly aggressive form of glaucoma. It's called neovascular glaucoma, and it is something that we'll see with diabetics, and it's aggressive to the point where in many cases the only way to control it is surgically, whereas in other forms of glaucoma there are eye drops that can control it. In this case, sometimes that's not the case, and it takes a surgical procedure, so we have to be very careful with this.
So, Dr. Rubin, what are the different types of diabetic eye disease?
Well, in the retina, we typically looking at two different types of condition, and one is diabetic macular edema, and the other one is diabetic retinopathy that Dr. Malley can expound on.
Well, then, Dr. Malley, what exactly is the retina and the macula?
Sure, Joe. I think it's beneficial to take a step back and look at the anatomy of the eye. We actually have a image on the screen here which shows the anatomy of the eye and all the different parts. The thing to always remember is that diabetes can affect any part of the eye. So any of these structures that we're mentioning, it can actually affect. So you can imagine your eye like a camera. In the front of the eye, we have the cornea, which is the clear part, which light first enters, and then goes through the pupil, and then it gets focused at the lens, and then it focuses onto the retina, which is like the film of the camera. And that's where I'm most interested in, and that's where we see a lot of the devastating changes from diabetic eye disease is in that retina part.
So then, Dr. Malley, what is diabetic retinopathy?
Well, diabetic retinopathy is basically changes from having diabetes in the blood vessels inside the eye, and especially the retina. And you can imagine these are very microscopic blood vessels inside the retina that help supply and give it nutrients. And you can imagine having high blood sugars in the blood flowing through these vessels causes them to get damaged over time, and they don't function as well as they used to. And that's where you see all these changes from diabetic eye disease, or in the small little blood vessels inside the retina.
So then, what is diabetic macular edema?
Well, diabetic macular edema is a condition that results from diabetic retinopathy, and it affects the very, very center of the retina. So you remember from that image in that graphic, it's right in the center portion of the retina where it's the most important for central vision. So it's our reading vision, our driving vision, our getting around vision. So it's the most important part. And these blood vessels leak out fluid, and that's what we call diabetic macular edema. It leaks out these blood components to cause swelling right in the center of the retina, and that's what causes devastating blurry vision. So that's what diabetic macular edema is.
Well, once again, Dr. Malley, I'm going to brag on you just a little bit more. I know that you were actually one of the first retina specialists in the United States to actually use a new steroid implant in the eye.
Yeah, actually, I was involved in the launch of a new steroid implant, which is a small implant about the size of like 1/25th the size of a grain of rice. So you can imagine very, very microscopic. That's implanted into the eye that helps treat diabetic macular edema by slowly releasing medication over a three-year period. And it's been shown to be very effective, and it's a medication that I instill in my patients. And really, I like to try to be on the forefront of new therapies and new technologies to give my patients the best possible chance for their best vision. And I think that's really important.
So, Dr. Malley, does diabetic retinopathy have any type of symptoms?
Well, typically, if it's very mild, no, you could have no symptoms at all. But usually when the diabetic retinopathy or you develop diabetic macular edema, you start having blurry vision or difficulty seeing at night, and that's typically the type of symptoms that we usually see. And sometimes, though, it can be very, very devastating and very, very sudden. You can have a large bleed inside the eye and cause complete visual loss. I actually have a patient who is a type 1 diabetic, very young gentleman in his late 20s. So really in the prime of his life, he had a job at the time. He started noticing that his vision was getting blurry over time. and he got to the point where he was basically unable to work. And he thought, well, I need a pair of glasses. So he went to see somebody for glasses, and they sent him to the emergency room because he had extreme changes from diabetic retinopathy. And he subsequently came to me, and I examined him. And when I saw him, he was legally blind. He was unable to drive. He was depressed. He was not himself. He was not his usual self. And we were able to get him on a very aggressive treatment regimen with injections and lasers, and now he's able to drive, he's working again, he has his own business, and he really has turned his life around. So for me as a physician, it's the greatest gift that a patient can give to a doctor is just being productive in society and living their life to the fullest. And to me, that was the greatest gift he could ever give me.
You know, and I think we all have stories like that, and we have to make our patients understand that they have to listen to their symptoms and they have to listen to their doctor. And you remember there was that patient who happened to be a neighbor of mine. And when I examined him, it was the first time that I knew that he was diabetic. I had no idea before that. And during the course of the exam, during the dilated part of the exam, I saw some very ominous signs, and I knew that things were not going to go well for this gentleman. And so we tried to get him to see you, and he had many excuses. He owned a business in town, and many excuses why he couldn't make his appointment. And then one day I get a knock at the door, and there he is, and he's telling, because he's a neighbor of mine, and he's pointing to his eye, and he says he lost the vision in that eye that day. So they've got to listen to their symptoms, and they've got to listen to us, because we can prevent these things from happening.
Absolutely.
Well, Dr. Malley, what are some of the current treatments actually available for the diabetic eye disease?
Well, that's the great news, Jill. We have new treatments now that are available that are really, really helping a lot of patients. I typically divide diabetic eye disease treatment into 3 categories: lasers, injectable medications, and implantable steroid implants. Lasers, the first category, lasers have been around for a long time. We typically treat diabetic eye disease with lasers a while back, and we still use it today. However, newer medications called anti-VEGF medications, or that second class that I mentioned, the injectables, is a new class of medications which include Eylea, Lucentis, and Avastin. And these are 3 great medications that we have available now that help treat diabetic macular edema and diabetic retinopathy. The last class of medications that I mentioned were the steroid implants. We have 2 now that are available. The first one is called Ozurdex, which is a implant that biodegrades, so it gets injected and degrades over time, and it usually lasts about 6 months. And the second one that I'll mention is the one that we mentioned before, called Iluvien, which I was involved in the launch project with. And it's really a fascinating implant that, like as it says, so microscopic, and is able to last up to 3 years in patients and provide that treatment for diabetic macular edema. So we really have a lot of treatments available, and it's really a blessing to live in this time when we have so much things available for patients. And I really like to customize my treatments to each individual patient.
So then, Dr. Malley, why would you choose one treatment over another type of treatment?
Great question, Jill. I mean, every patient is different, and every patient deserves to have their own treatment regimen. So I really tailor my treatment to each individual patient. And it's really important that, I provide my expertise and my knowledge to each patient, but also I want to involve them as a team approach. So it's really important to involve the patient in the decision, as well as any family members that are supporting them, to everybody to be involved in the decision and to have a treatment regimen that's appropriate for each individual patient. So here at the eye associates really customize our eye care to each individual patient, and that's so important to do.
Well, I know you spoke about staying on the forefront with medication. I believe the Eye Associates is actually involved in FDA studies.
Absolutely, Jill. Here at the Eye Associates, we're involved in several studies. You can go to our website or call our number and find out what studies we're currently involved in. We're currently going to be involved in studies looking at diabetic eye disease and new treatments that are available. So it's just really important. I really take pride in my craft and being on the forefront of new therapies and technologies to give patients the best chance to see their best. And I think that's so important.
So the viewers can actually call from the number on the graphic. Dr. Rubin, how often should a person with diabetes actually have an eye exam?
Well, that's a good question, Jill. And the answer to that is it varies. Certainly at a minimum, it's going to be once a year. But depending upon what we see during especially the dilated portion of the exam, we may tailor that to the individual. So that if, for example, a patient is a known diabetic with minimal or no signs of diabetic eye disease, and they may be low risk, and they're well-controlled diabetic, then we may say once a year is adequate. But when we start to see more of the ominous signs of diabetic eye disease, then we're going to shorten up those visits so that we can prevent loss of vision, because the loss of vision can be irreversible. It's not like when somebody gets a cataract, their vision gets worse, and then we make them better. Some of this can be irreversible, so we want to catch it early enough so that Dr. Malley can intercede and we can have a good outcome.
Well, Dr. Malley, is a diabetic exam different from a traditional eye exam?
Well, Joe, every person that walks through the eye associate's door, we always give them a complete, full eye exam. And I think that's really important to establish a comprehensive eye exam. And part of that is a dilated eye exam. And that's the most important, at least from a diabetic standpoint, and looking at the retina, and from my standpoint, to see if there are any changes from diabetes. And we're able to actually see those. And actually, I have at my disposal new technologies that are now available to help get a better idea about how the eye is doing and what's going on inside the eye. So for example, I have something called an OCT machine, which actually gives me a microscopic view of the anatomy of the retina. And I'm able to pick up very microscopic changes from diabetic macular edema or swelling. The other great technology that I have available is something called a fluorescein angiogram, where I'm able to check the circulation in the back of the eye, and I can actually physically see these small little blood vessels inside the retina. I can see how well the blood flow is moving. And so I really have a lot of technology at my disposal, in my arsenal, that helps give patients an idea of how are their eyes doing, and classify them into different stages of diabetic retinopathy. So I think it's really important to give the patient the full picture and showing them how their eye is doing and where do we go from here.
And OCT is the newer of the technologies, and it is a powerful imaging technology, and I liken it to doing an MRI. It'll give a cross-sectional view of the retina. We can see all the layers of the retina, just like an MRI, except it even has higher resolution than an MRI machine does. It's just amazing, and you can stage the disease much more easily with this.
That's amazing. Dr. Rubin, should family members of a patient with diabetes be examined? Well,
we mentioned earlier that one of the risk factors is family history, and absolutely, if someone in the family is a diabetic, it behooves that your relatives to get eye examinations and be screened by the primary care physician for diabetes, so that, again, we catch this as early as possible, manage the disease well, get on a good lifestyle for treating the diabetes so that a person can live a good, long, healthy, productive life.
Well, now, Dr. Rubin, can patients that are diabetic wear contact lenses?
Jill, I've been fitting contact lenses for a long time, and I do fit contact lenses to diabetics. But one thing we really haven't talked about is that diabetics suffer from what we would call impaired healing. And certainly wearing a contact lens is not without risk. So when you wear a contact lens, it's sitting on the front of the eye, it's kind of rubbing against the front of the eye, and we get little micro abrasions every day wearing a contact lens, which for most people will heal up overnight, and you can begin to wear your contact lens the next day. With diabetics with impaired healing, sometimes these little micro abrasions turn into something bad, like possibly even at the worst a corneal ulcer. So I will caution diabetics that wearing contact lenses is an increased risk to the health of their eye. I encourage all patients to remove their lenses in the evening, but certainly the diabetics, and we go over the regimen of caring and cleaning and hygiene with their contact lenses.
So, Dr. Malley, can diabetes be cured?
Well, right now, Jill, we don't have an actual cure for diabetes, but I think the future is so bright. Again, from the eye side, there's so many new trials going on, and we're involved in studies here at the Eye Associates. So I think we're getting more, better and better treatments that are available from a diabetic eye disease standpoint. But also, I think there's new systemic treatments that now are available for diabetes. And my hope is that like I said, the future is bright, and I'm hopeful we're going to have a cure.
Well, Dr. Rubin, most importantly, what can someone with diabetes do to keep themselves healthy?
Well, I think in terms of the big three, the ABCs of diabetics, and that A would be the A1C number that Dr. Malley mentioned. People should know what their A1C number and strive to keep that number as low as possible. And we teach them how to do that. The B would be the blood pressure. Diabetes and blood pressure go hand in hand, and C would be to manage their cholesterol levels. Those three are metabolic issues that all go hand in hand in managing diabetes.
And it's so important to get regular exercise, eating right, a good diet, stop smoking, taking your medications, monitoring your blood sugars, seeing your primary care doctor regularly. All these are so important for your overall health and managing your diabetes.
So, Dr. Malley, if a person would like to be checked for diabetic eye disease, what would be the first step for a viewer to take?
I think the first step is to pick up the phone and call us here at the Eye Associates. We're happy to see all patients, and give us a call, and we're going to schedule you for a complete eye exam.
So, Dr. Rubin, when you're looking at the back of the eye, you can actually tell if a patient has diabetes.
Absolutely. The front of the eye is the window into the body. We can view the little tiny blood vessels during the dilated eye exam that you can't see anywhere else. So where diabetes may also affect kidneys and other organs of the body, it's mirrored in the back of the eye. And with our instrumentation and dilating drops, we can actually view that. And if we're seeing problems in the back of the eye, there are problems in the kidney, for example. So it's a very good indicator of the stage of the disease.
And why should a patient come to the Eye Associates, Dr. Rubin?
You know, the Eye Associates has a tremendous reputation. It's over 30 years of giving quality eye care to the communities that it serves, and we do that with excellent trained doctors and staff. We have over 16 board-certified physicians. We have certified technicians, and we have the largest staff of Florida licensed opticians in the area.
And we're, full service, one-stop shop. We have eye care, optical, cosmetics, dermatology, hearing. So we really are a one-stop shop.
Well, and I know that you've been repeatedly chosen as best ophthalmologist, best optometrist, and best eyewear by our community. But unfortunately, we are out of time. Thank you, Dr. Malley, and thank you, Dr. Rubin, for helping our audience learn more about diabetes and the eyes. And thank you, audience, for joining us today. We'd love to hear from you with questions and suggestions for future shows. Just give us a call at the toll-free 1-866-865-2020 and mention the TV show. Or if you'd like to make an appointment with one of our award-winning doctors, we'd love to see you. Just call the toll-free number on the screen. Our goal is to keep you seeing your best and enjoying your life. So for now, I wish you the best sight for life and so much more.